A lot of people tend to think about blood vessel health in very narrow terms. They focus on lab numbers, medications, and ways to keep arteries clear. But there is another crucial function of the vessels that is discussed far less often, and it is exactly this function that determines how well blood can actually flow through them. We are talking about the ability of vessels to dilate. And here is the interesting part. A vessel can be completely clean, without significant plaques, and still not function properly. This process is called endothelial dysfunction, and at the center of it is one small molecule, nitric oxide. You're with Dr. Helena, and in this video, we'll break down why vessels lose their ability to dilate, what role nitric oxide plays, and what you can do to preserve this function. Nitric oxide is a signaling molecule. Simply put, it is the main messenger in the body through which cells communicate. For example, it sends signals to the smooth muscles in the vessel wall to relax. As a result, the vessel widens. Blood flow improves. Blood pressure decreases. This is one of the key mechanisms regulating vascular tone. It is thanks to nitric oxide that vessels remain alive and adaptable. Interestingly, the discovery of nitric oxide's role in blood vessels was awarded the Nobel Prize in 1998. And since then, thousands of studies, including data from PubMed, have shown that reduced NO production is one of the earliest signs of vascular problems. It often appears before atherosclerosis. So what happens in the body if this messenger stops delivering its signals? Problems begin with memory and sleep. Immunity weakens. Vessels lose elasticity, become stiff, and this directly leads to high blood pressure, atherosclerosis, blood clots, and erectile dysfunction. Many aging processes are associated, among other things, with a deficiency of this molecule. While we are young, the body has a powerful, so to speak, main factory for producing nitric oxide. The main mechanism of its synthesis is the endothelial pathway, which takes place in the vessels. Here it is quite simple. The enzyme ENOS, endothelial nitric oxide synthase, converts the amino acid L-arginine into nitric oxide. This is the main pathway in a young and healthy body, but it is extremely sensitive to oxidative stress, and this brings us to the main problem. With age, it is not so much the production of arginine that decreases, but the activity of NO synthase. But the body is very adaptive. Nature has given us a backup pathway. And when the main pathway starts to decline with age, we can activate a second one, which interestingly depends entirely on our diet. This is the nitrate-nitrite pathway, and this backup system is truly elegant, and importantly, it is almost independent of endothelial function. Here is how it works. Step 1. We eat vegetables rich in nitrates. Step 2. Facultative anaerobic bacteria in the mouth convert these nitrates into nitrites. Step 3. In the acidic environment of the stomach, these nitrites are converted into nitric oxide. And finally, step 4. It is absorbed into the bloodstream. Now, a logical question. Are nitrates dangerous, since they often cause concern for many people? In fact, recent studies show that nitrates themselves are not only safe, but beneficial. What is potentially harmful are nitrosamines, compounds formed when nitrates or nitrites combine with proteins. These are produced, for example, when processed meats like sausages or bacon are cooked at high temperatures, where nitrites are used as preservatives. Those compounds can be carcinogenic. But in vegetables, the situation is completely different. There, nitrates work in our favor. So why does nitric oxide production decline with age? The activity of NO synthase does decrease over time, but that is not the only issue. The first mechanism is oxidative stress, where even if nitric oxide is produced, it is quickly inactivated. When the level of free radicals increases, they begin to destroy NO molecules. The second mechanism is when the cells that are supposed to produce NO synthase begin to function less effectively. This happens when the endothelium itself is damaged under the influence of high blood sugar. It disrupts endothelial function and reduces the activity of ENOS, the enzyme responsible for nitric oxide production. Chronic inflammation, During inflammation, the activity of the enzyme arginase increases, and it uses the same arginine needed for NO production, effectively stealing it. Smoking. Tobacco smoke contains a large number of oxidants, which essentially burn out nitric oxide and damage the endothelium, making it one of the fastest ways to impair vascular function. High blood pressure. A sedentary lifestyle, because movement is one of the main stimuli for nitric oxide production. Without it, vessels literally forget how to dilate. And the third level goes even deeper: substrate deficiency. Even if the cells are functioning, they may lack the necessary resources. To produce NO, the body needs L-arginine and tetrahydrobiopterin, BH4. If they are insufficient, nitric oxide synthesis decreases. But there is an even more important point. Under these conditions, the enzyme may start working incorrectly, and instead of producing nitric oxide, it begins to generate free radicals. So the situation does not just worsen, it actually reverses. Now the most practical question. How can you understand what is going on with your vessels and nitric oxide levels? Measuring it directly is difficult, but we can assess the effects. FMD, flow-mediated dilation. This test shows how well a vessel can dilate. It is directly related to endothelial function and nitric oxide. Pulse wave velocity, PWV. The stiffer the vessel, the faster the wave travels and the lower its ability to dilate. There are also indirect signs: high blood pressure, reduced endurance, cold hands and feet, fatigue, decreased concentration. Now the most important part: what affects nitric oxide production? First, physical activity. When we move, blood flow increases. This creates what is called shear stress on the vessel wall, and it is exactly this that stimulates the endothelium to produce NO. This is one of the most powerful natural triggers. Second, nutrition. Regular consumption of beetroot, arugula, and spinach, which are rich in nitrates, activates the nitrate-nitrite pathway, which, as we remember, is more reliable after the age of 40. Important: avoid using antibacterial mouthwash unnecessarily, as it kills the bacteria required for this pathway. Also include sufficient antioxidants, vitamins C and E, polyphenols, to protect NO from premature breakdown. Third, blood sugar control. Glucose directly damages the endothelium and reduces NO availability. Fourth, quitting smoking and reducing chronic inflammation. Fifth, sleep. There is evidence that chronic sleep deprivation impairs endothelial function and reduces NO production. Interestingly, even short-term lifestyle changes can improve vascular function. In some studies, improvements in endothelial function were observed within just a few weeks. Sixth, specific nutrients. For example, arginine and citrulline. Arginine is the precursor for nitric oxide synthesis. It comes from food, nuts, fish, meat, legumes. But remember that with age, the efficiency of this pathway declines because it depends on eNOS activity. This is where citrulline comes in. It is converted into arginine inside the body and, in some cases, may be a more effective source. But does that mean arginine is completely useless for older adults? Not exactly. Clinical studies show the situation is more nuanced. For example, in studies involving patients with heart failure, one group received standard treatment and showed no significant changes. Another group received L-arginine in addition to standard therapy, and their vascular function improved, blood viscosity decreased, and overall quality of life improved. So the conclusion is this: for most people, it may not be very effective, but in certain clinical situations, under medical supervision, it can be beneficial. An interesting note: there is also a well-known drug that works through nitric oxide, even if people do not think about it: nitroglycerin. It also leads to NO production, but through a completely different biochemical pathway. It is used not for general vascular support, but in emergency situations, such as angina. So it is not a regulatory system, but an emergency mechanism for rapid vessel dilation. It is not for prevention, but for acute care. It is important to understand vascular health is not just about the absence of plaques. It is about flexibility, adaptability, and the ability to hear signals from the body. Nitric oxide is the voice of your vessels. Do not let it go silent. Vessels do not age only because of cholesterol, and not only because of calcification. There are functional changes that occur much earlier, and endothelial dysfunction is one of them. Problems with nitric oxide are never due to just one cause. It is always several layers of disruption that overlap. The better we understand these processes, the more opportunities we have to influence them. Take care of your vessels, because they determine how long and how well you will live.